If I squeak, it's not my fault.
If you squeak, if she squeaks, she squeaks. So if she squeaks, it's not her fault, she says. So if we're going to call this Extensor Brevis, right, inserting along here, you can see actually tape lines on her because we had tape on her recently. But pretty tender on there. And it's tender when you grip. Yeah. So she was just carrying luggage, right, because we were coming here, and so she was lifting them, and that always re-injures it, of course. But there's not much to do when you have little kids and you're traveling, right? There's always luggage. So we're going to be treating kind of this general area. Can you point to me where you feel the pain?
Right around there.
So it's on the back side a little bit too?
Side is this around.
So it's kind of, so it started out on her here, and it's kind of now included a large area. So we've got some other attachments here. So the epicondyle is here of the humerus, right? Here's ulna. So ulna comes up the backside and slots in between the two epicondyles, right? So we've got some ulna to think about, triple wormer channel, large intestine channel, and then this, the head of it here, and then of course this muscle. So when you extend your hand up, does that cause pain?
Yes, right.
And where do you feel that? And it actually runs down the muscle itself. So this is a great case to tape the whole muscle because she's feeling the whole muscle, not even just the attachment.
Can I take this off?
Yeah, go ahead.
Sorry.
So we want that muscle attachment on the leg at where these extensors go, right? So the extensors come this way, and they attach along the tibia, and they attach, the digitorums attach along the fibula, right? So we've got like a long area of attachment here and here. So it may take a number of points on both. And we're going to get close to the bone because we want to get the attachment that's at the bone. So we're going to needle along here, and we're going to needle along there, and into the belly of it as well. So we're going to maybe even have 3 rows like that. I'm not going to worry too much about where it attaches on the, you know, whether it's tibialis anterior here or whether it's some of these palmaris longus, probably fine. I'm not going to worry about those attachments on the foot so much because you're not having any symptom in the hand.
Not right now.
No. So we're going to stay with belly of the muscle and with attachment origins there and there. And then we might look at medial and lateral epicondyles of the femur to treat medial or lateral epicondyle of, in this case, lateral of the humerus, right? Do we have needles around as well? I forgot to ask first. Sorry, Donna. We just are, maybe we'll tape it first then and then needle it because we're going to wait for the needle. So let's do the first version of the taping. Let's see how long so she has very kindly already cut her own strip. Thank you for cutting your own strip. So it is pretty much a good length. This is, once we stretch it, it's going to go a little bit longer, right? So we're going to have a little bit longer than we need. I might trim it a tiny bit shorter. 38. Thank you, yes. 1.5? Yay, that's what I like. So good. 38, 1.5, my preferred needle. So I'm going to make it just that's actually not too bad. So I don't mind if it goes a little too long. We might do the kind of a hybridized version of what we just talked about. So the first 2 versions of taping this lateral epicondyle, we talked about one that went the cross strip over the epicondyle itself, and then that one that kind of wrapped down. This may make it to both, because it may make it all the way to the second type, which was this version with then a piece across here. So I've preferred that version of it up until now. I've recently seen this other version where they put the cross here. So let's try the first one. So we will twist and tear to get an anchor point. Try not to touch that adhesive. So we're going to put no stretch where these attach. So here's our, oh, by the way, if someone has lotion or something, we want to clean that off first. So we would want to wipe it down with alcohol or something and clean it well. Otherwise, this won't stick very long. So we're going to attach it on the back of her hand here. And we're just going to warm that up a little bit. The adhesive tends to stick better when it's a little bit warm. So you can use the back of that tape we just took off, the backing, to warm it up a little bit. And then we're going to get ourselves another little bit of tape. We're going to peel it like so. And then I'm going to have you put this in an extended position. Still see it okay, Sam?
Yeah.
And then we're going to go we're going to put like 25% on this. So there's 100%, there's 50%, there's 25. And we're going to just kind of lay this on right over that attachment. And again, no stretch on the end, right? I just didn't do any stretch at all on the end. So, and then we're going to make sure that that's all attached. We got a little bit of a wrinkle there, which is really no harm. And then we're just going to just lay it down. Again, we're going to rub the back of it to make sure it adheres very nicely. It kind of activates, the heat sort of activates that adhesive so it sticks well. That's our first piece. Our second piece is going to go basically as a kind of a newer attachment point. So we're going to kind of take some strain off of, you know, this area where she's attached now. So we're going to kind of add a kind of a newer spot. So we can put her in this position. And for this application, we're going to tear it in the middle this time, right? And then we're going to give ourselves 2 anchor points. And we're going to go stretch. So there's 100%. 50%. I'm going to go a little bit less than, just a little over 25 or so. And we're going to put it like that. And again, no stretch on the anchor of it. No stretch on the anchor of it. All right, and again, we're going to rub that to warm it up. Does it feel okay? Sometimes you'll see a quick change in the pain level right away, especially with like something like ribs. I've seen like an instant pain relief. Whether that's just like a support kind of an issue, or was there pain when you were just laying there like that before?
There's like a little bit of shooting pain on that elbow.
Do you still have that?
No.
Or does that feel different with the tape? I'm just wondering if the
Feels
tape,
different,
the tape made it different?
Yeah.
Okay.
Every time we tape it always changes.
It always changes it. And how much difference would you say the tape has made?
The shooting that comes here, it's not there.
So
I'm feeling the milky probably from the tape. Right?
it feels a little bit like a coolness from the
coolness.
tape? Interesting. It's not a medicated tape that I know of. It's just a basic tape. Interesting.
Probably the support of it.
Maybe the support of it. So it's giving a little bit of a pull together, right? Like it's pulling the tissue together.
Yeah.
Does it feel like there's a little bit of a pulling?
Rubs to it.
Mm-hmm. So we're creating a little space, you know, in that area where the muscle's irritated. So that's great. And then we'll treat those spots. So do you still feel it anywhere right this second?
Just tiny. Actually, it moves. Tiny.
Kind of in the backside?
Yeah.
So I suppose you could put another piece there, you know, and try to create a little gap, like the other one had like a cross, you know, on that spot. That might be another application for her that we would try.
You should try it. See if
Maybe we'll do it tomorrow. Yeah, try it again. So, but let's treat it and see if we can make a difference with the acupuncture as well. So again, these attachments running up both sides, tib and fib. So we'll just clean those, belly and origins of those both. Again, we're not going to worry. She's not having a problem at the attachments of the insertions. So we'll do belly and origins. So I will use a tube for camera purposes, right? We'll be as clean needle as California wants us to be, I suppose? Or is it all the boards now? All the boards, right? Yes. Yeah. So I usually freehand, but we're going to use tubes here. So that's our insertion. So I'm just kind of trying to find it. So this is more of a belly point. And we're just going to go into the belly of it here. We're going to do a few points down the belly of tibialis anterior, right? Another one there. Another one here. We're just going to go kind of into the muscle. I might get a little bit of a turn just to get it to grip a slight amount. What I'd like to do as well is treat, again, those insertion points. So now here's the ridge of the tibia. As I run down it, you can see that it gives, right? Look how far over that ridge goes. Like she's got a small scar here. But right on the inside of that, right? So here's, let's start with one about here. So we're right off the ridge of it. And I'm going to want to keep it as close to that ridge as I can because that's where the attachment runs. So I'm basically going to run into the tibia basically on purpose because I want to know how close I can get to it. So I'll run into it, I'll back it up and change the angle, I'll run into it again, back it up, change the angle, and then slide past it. That's the plan here. So there's running into tibia. So we're going to back it up, change angle a little bit, And now we just slid past it. Very close to the bone there, right? Second one we'll do, I'm going to go every maybe 2 soon, 1.5 soon, something like that. So here's our ridge again. So I'm using my finger to kind of find that ridge to stick up. And we'll come right next to it. How does it feel with the point? Does it hurt or not really? I mean the needles themselves. They feel okay? Great. So here's our ridge. See, I'm just to the medial side of the lateral side of the ridge, right? So we're going to run. There's running into the ridge. I'm going to change my angle a little bit. There we go. So now we're sliding right along the ridge. I can kind of feel it kind of run. Again, 38 gauge needle, so maybe it's very flexible and it's able to like curve as it goes along that ridge, right? That's very possible. And we'll do a third one on that ridge. So here's our ridge again. And there's the point that goes in. Again, there's our ridge. So I'm a little bit medial to it, aren't I? I'm kind of right at the ridge. So we're just going to, it's okay? Needle okay?
Yeah.
So that was catching something. We'll back up and change our angle a little bit. Is that okay now? Muscle reacted a little bit more, and we're again right on the ridge as we slide along the edge. So that's the tibial ridge. Then we'll do the radial ridge, ulnar ridge. So head of ulna here, 34 there. So we'll start up pretty close to 34. Let's find our, there's our ulna, tracing it back. There's the back side of the ulna. There's right at the ulna. Right. Yeah, so she's tender right on it. So that's those fibularis attaching along that lateral side. And she did have it a little bit more lateral in the elbow, right? Like her elbow was a little bit laterally, like she had some lateral to those muscles. So that lateral I don't mind. So we'll do the classic kind of 34 at the fibular head. A lot of times I like to run into the fibula like that. So I'm kind of tapping at the tibia, at the fibula. So I'm going to back up, change the angle a little bit, medial, still running into it. There, it went right past it. So we're just right at that attachment edge, right? And then we're going to, is it okay?
You're going to get it later.
Too painful, she said. That's her way of saying too painful. So again, right at fibula here. There's the bone. So I'm at fibula there, fibula. So we're going to back up, and there we got a little trigger, and there it went right past it. Perfect. Such a good sport. Any change in the elbow? Yeah. Is that spot that was still achy, or has it eased up?
No, it's not there anymore.
Not there anymore. Maybe she just doesn't want any more needles. What do you think? One more.
She's an honest person, I believe her.
She is honest, and she even said you can put more if you want, but it doesn't hurt anymore. So that was nice, right? So sometimes I'm playing with, because some of that attachment comes all the way up around where this tib and fib come together, right? So sometimes I play with this area. I don't think we need it on her. She did have some that was kind of posterior, so I might kind of look on the back side where this fibularis, yeah, and there's a real gummy spot. I think if those of you who know Ton's later days, he did a Ton's gallbladder 34, and that's what this is right here. It's really gummy. And then along the back side. So that was so reactive, I think I want to go get it. This is the job of an acupuncturist. The most tender point you can find, and you put a needle in it, right? Like that is our job.
No, she was saying something on...
It's shocking.
You got an electrical?
Yeah.
Is it still?
No.
No.
Just
an initial radiation down the... So that's pretty good. I probably leave it like that, especially if she's had a result on it.
Yeah, it's done.
If I've treated her a number of times and I know that doesn't get it all, probably I come, like I said, around the head of this fibula and where it meets the tibia, and I look for stuff up here and maybe even superior to it. And then again, if I think the epicondyle bone attachment the bone itself is having an issue, then I'm up here looking for the femur medial or lateral epicondyle, right? So I might look kind of out in this area.
Is that around here you're doing?
Yeah, it's a little higher. You're still feeling something higher?
That's right.
Yeah, that was
It kind of
going
move
to
up.
ask if she feels higher.
Higher, exactly. And then here too?
Yeah.
So, like I said, because of that anatomical change with the elbow and the knee, I can't decide whether the lateral or the medial is better. And clinically, they both work. So I end up doing both. Typically, I will palpate, and whichever one's more tender, I will use that. So on her, which one would you say is more tender? This one? That one's pretty tender. And then
That one's not so bad.
this one's not so bad. So in her, it's the medial one, which I say, in my head, logically works better. Spleen kind of 10, yeah. So again, we're going to get the exact spot. So that's pretty good. That's pretty good. That one too? No, more distal. This one?
That one.
This one too? How about farther distal? I would say that one.
Yeah.
So let's make sure we're on this. So here's the medial condyle itself, right? How about that? How about that? No, it's a little bit, yeah, it's a little bit inside and up. So it's kind of through almost spleen 10. It's pretty superficial. So we're going to go slow because I want to get it to the epicondyle. What's it doing? Is it electrical, painful?
That's it. It was just
We'll just leave it like that, I guess. Typically, I want to go to the bone because I want that bony relationship with the condyle itself, right?
It's not in the bone yet.
No, it's just in the muscle. The muscle's really reacting. But because of where the muscle attaches, it's reacting. So has it calmed down enough to...
Try it.
Okay, so what I find is if it reacts too superficial, this is actually a really interesting question about how do you needle when you're going for deep needling and someone reacts superficially, what do? I will let that dissipate, and depending on the sensitivity of the patient, I want the point, the three-dimensional depth. So I will wait till it dissipates, and then I will go slowly and steadily, knowing that my intention is to go deep, and then it usually won't react again until I get to the level I want, right?
And you mostly always needle deep, you said?
It depends on the spot. If I'm treating skin, I'm super. So actually, we are right at the epicondyle. I mean, I'm hitting femur here, so we were right there. It's just she's small. So, and it's an 1.5 needle. So I mean, it's in in almost 3/4 of an inch. So it is right there. I'm tapping on tibia there. So or fibula, femur. Got to get these names right, or you guys are going to be confused. Okay, so that was. Thank you. That was a good treatment for you.